A stage 4 breast cancer drug is now being considered to treat some breast cancer patients before surgery. Some oncologists are saying this could be a huge breakthrough for breast cancer patients with the HER2 gene. The cancer drug is called Perjeta. KETK's Hamilton right now live in time with more on this.
Neil, the Food and Drug Administration voted 13-0 to push this cancer treatment forward. In a trial, they discovered Perjeta can be used before surgery to help reduce a woman's tumors and save them, a woman, from removing her breasts.
The cancer drug Perjeta was used for patients with stage 4 breast cancer. Now, with the first approval from the FDA Advisory Committee, the drug can be used before a patient goes into surgery.
That's a historical, piece because we are changing how we are looking at new drugs.
Medical oncologist Dr. Sasha Vukelja says this new treatment will only apply to 20% of patients suffering from breast cancer. The treatment will be used for patients with the HER2 gene, which Dr. V says it was the most aggressive form of breast cancer.
It's a small fraction, but it's a significant fraction.
The trial showed 39% of patients who were treated with the drug Perjeta and Herceptin, along with some chemotherapy, showed no signs of invasive cancer in the breast tissue. That was compared to 20% of patients only treated with Herceptin.
It's a big difference, almost doubled, when you added another medication, another chemotherapy, Perjeta, on top of that.
This new treatment, Dr. V says, can shrink the tumor small enough to remove and can save a woman from completely removing her breasts, and can be the breakthrough for faster approval of cancer drugs.
It will give us a lot of information, and maybe this is the way to proceed with the next generation of drugs to approve them faster, so we don't wait 10, 15 years to get the results.
Now, Dr. V says this is a huge milestone for the 20% of breast cancer patients with the HER2 gene. But for the other 80% of the patients, they will not be eligible for this treatment. Now, coming up at 6, we'll talk more about who's eligible for this treatment and the side effects of it. Reporting live in Tyler, Marlena Hamilton, KETK News.